Health Action Party was founded in 2012 by two consultants who opposed the Health and Social Care Act, which enacted wide-ranging reform in the NHS. The party would start by repealing the 2012 Health and Social Care Act, which would reverse the reforms, including the removal of the requirement to tender out contracts to the private sector. They'd also ensure that NHS funding increases in real terms by 4% every year, and call for the abolition of prescription charges in England, as is existing policy in Wales, Scotland and Northern Ireland. The party would introduce free social care and increase funding to meet the needs of vulnerable elderly and disabled people. And on Brexit, the NHA want to safeguard the UK's collaboration with the EU on health issues and medical research. And now we're joined by the National Health Action Party's Dr. Louise Irvine. Thank you for coming onto the programme. The National Health Action Party is standing in 5 seats in England. Why do we need your party?
Our party started 5 years ago with the intention of fighting to defend the NHS against cuts, underfunding and privatisation. I feel we need it now more than ever before. We have grown in support, we've had quite a wide influence. I actually think we've influenced Labour Party policy at the moment, which has actually moved closer to our position.
Right, but it's a single-issue party, is that right?
We're not a single-issue party. We fight on all the social determinants of health, and if you think of that in the broadest sense, that includes housing, education, the environment, inequality, poverty, and all those issues. So we've got policies on a wide range of issues.
You say you've influenced the Labour Party. Which bits of the Labour Party manifesto would you say have been written with you in mind?
I think we're part of a broader movement that has influenced the Labour Party and moved it more towards, in the manifesto it talks about repealing the Health and Social Care Act, which we as campaigners, I've been a campaigner on the NHS for many years, including when under Labour government, it's been very reluctant up till now to actually address the issue of privatisation of the NHS. And it's good, I welcome that, but I feel we need people like our party and people like me and campaigners to actually help.
So you've got Louise to thank. You've got Louise to thank for your manifesto. And of course, it was under Labour that the opting out to the private sector contract started.
Well, I'm pleased for the endorsement for the policy that I've put together as the Shadow Health Secretary.
But would you have done it without them?
Yes, I would have done it without them, if I may say so. And the reality is the party of the NHS in this election is the Labour Party, because we're going to put £37 billion into the NHS to reduce the waiting list. Yes, we're going to get rid of that Health and Social Care Act, but also we're going to put capital investment into the NHS, not by forcing hospitals to sell off land and sell off assets under the Naylor review. We're going to give hospitals the money to rebuild them and invest in their IT as well.
And would you rather see Labour Party being elected than the Conservative Party, for instance, in seats?
Yeah, I would prefer them to be elected as long as if they were elected, that they stayed true to their promises.
Do you think they might not?
In 1997, Tony Blair promised to end the privatisation of the NHS and to get rid of PFI, not to go forward with PFI, and they did the very opposite in power. So we can't afford to completely trust people just what they say in their manifesto.
All right.
When you say about the funding, your proposed funding is actually not even going to meet the projected rate of growth if it kept up with GDP rates.
Well, let's talk about your package. If you say the Labour Party actually isn't going to keep pace with either a growing elderly population and perhaps rising inflation at the moment, how would you fund an increase in NHS funding of 4% in real terms every year?
Well, this is not a number we've picked out of the air. This is what the OBR and other health policy analysts say is the amount that will be needed to meet the funding gap, to maintain the quality of services and to meet growing demand. This 3 to 4% is in keeping with the long-running average and the average around other developed countries.
And people want to know how you're going to fund it.
It's not my job. I will not be part of the government and I will not be making detailed budgetary plans, but what we will be doing is pushing government, whoever is in government, to meet that funding need. And it can be done through taxation, in different ways, progressive taxation, but also looking at tax avoidance, looking at corporate tax and all those things. It can be done through reducing the bureaucracy in the NHS, and that will release funding. And also investing in health and education has a 4-to-1 return on the economy.
Do you accept that actually, in order to meet the needs of a growing elderly population and rising costs, that you would need to look at funding of 4% in the round, 4% every year in real terms in the NHS?
Well, I had a look at the National Health Action Party manifesto, and the problem is the aim is to have the average of G7 funding, but most G7 countries have either an insurance or contribution-based approach.
Like Germany, for example,
exactly.
or France.
We don't do that, and our NHS is unique, and we have invested 23,000 more doctors.
But your answer
is
no, you wouldn't do those levels of funding.
But what you've got to do, the answer on funding is very clear, is you've got to have that strong economy. And the problem is all these wish list of issues that you want to spend more on are for the birds unless you've got a strong economy.
Except if you had a strong economy, why couldn't you spend more if you had different priorities?
If you've got a strong economy, only Conservatives deliver that. Sure. It's the only way you get the revenue. And it's revenue that pays for public services. So having a wish list is for the birds. Unless you've got the strong economy, only the Conservatives deliver that.
Just finally, Louise, on the private sector, do you think then there is no role at all for the private sector within the NHS?
I think there could be a very small role in the odd place where there are gaps in provision temporarily. I don't think you should structure the NHS around a market-based system. That market-based system is wasteful, it fragments, it's chaotic, and it increases bureaucracy, and it shortchanges patients because it diverts money from frontline care. So we would have an NHS which is substantially a public service, and we would want to bring legislation to reinstate it as a public service, more than just repealing the Health and Social Care Act, but actually reversing all the privatisation.
Louise Irvine, thank you.
Thank you.